Hello, my name is Terry Bergen, and I am the Public Information Officer from Lincoln Trail District Health Department, here today to give you an update on COVID-19. As of press time, which is 4 o'clock yesterday afternoon, August the 13th, there were 724 cases of COVID in Hardin County, 74 in LaRue, 120 in Marion, 128 in Meade, Nelson is at 255, and Washington County 91, for a total of 1,392 cases of COVID-19 in the Lincoln Trail District service area. Since June of the beginning of July, we have seen an increase in the number of cases of COVID in our area, and it has been an accelerated increase. What we know for sure, and I've spoken to you about this on many occasions, is that we have community spread in our counties. Community spread meaning that a lot of individuals obtain COVID-19, but they don't know exactly where in the community they picked it up from. So that is happening in our communities. But we also have accelerated spread in 3 of our counties. Hardin County is one of those, which means that the COVID-19 is spreading at a pretty rapid rate. And so Kentucky has a very high disease burden of COVID-19. So it is very important, it is imperative at this point that we do what we need to do to stop this acceleration and reduce the spread of COVID-19. The points that I continue to bring to you every time I speak with you is that it is very important that we continue to wear our cloth or our face coverings when we're out in public, that we continue to wash our hands frequently, 20 seconds or more. If hand washing facilities are not available, that you use a alcohol-based hand sanitizer, at least 60%. That you physically distance of 6 feet or more. All of these things will help reduce the spread. If you're home, that you're cleaning frequently touched places like doorknobs, light switches, refrigerator handles often. If you're at work, that you're doing the same thing, that someone is doing the same thing, cleaning those frequently touched areas often to help reduce the spread of COVID. School is going to be starting up relatively soon, and we want to make people aware that the school system, Hardin County Schools, are working in conjunction with Lincoln Trail District Health Department to develop really comprehensive plans to address COVID while the children are at school. We have worked in partnership, we've considered CDC guidance, we've obtained the guidance from the Kentucky Department of Education. All of that has come into play in driving what is included in these plans. Keep in mind that this is a difficult situation, and we are doing the best that we can in partnership. The schools are doing the best that they can in partnership with Lincoln Trail District Health Department to create the most comprehensive plans as possible. But I must stress, and I have to return to what I've said earlier, that we're concerned. We are looking at this, Lincoln Trail District Health Department is looking at this through a public health lens, and we're looking at the data. And the data says that we need to be concerned. We have seen since the end of June 30th, we've seen 144% increase. So from June 30th to the end of July, July 31st, we've seen a 144% increase in COVID-19 cases, 176% increase in cases among young adults to 20 to 29 years old. We've seen an increase of 68% in the number of Hispanic cases. When we look at children aged at birth to 19, since July 1st to Monday, so that would have been August 10th, there has been an increase of 74% in the number of COVID-19 cases in children from birth to 19 years old, and 32% of those children are young adults are asymptomatic. So we must express our concern going forward while we look at the data to drive our decisions on school reopenings and how we plan to how the school plans to reopen safely. Now, included in their plans are components of what I've already expressed. How do they physically distance it safely? Wearing masks, the children wearing masks, washing hands, having the facilities for the children, the hand washing facilities and the hand sanitizer, how to do all of that. Kind of going back again to what I said earlier about accelerated spread and it spreading rapidly within our counties, one of the ways that that acceleration happens is through large gatherings. So as we look at the data, it does give us pause as we get closer and closer to reopening because it shows us that our cases are increasing within the county. Now, if someone is sent home because they have a fever, I think it's important to realize, even though we're in the midst of COVID, that fevers are caused by other things. So if someone is sent home by COVID because they have a high temperature, they should talk to their healthcare provider. Their healthcare provider should determine if they need to do a COVID-19, and they'll probably do an assessment for other symptoms as well. The conversation between the staff person or the parent of the student who might have a temperature will drive whether that child will be tested for COVID-19 or not, or the staff member will be tested for COVID-19. One of the things a lot of folks have a question about, a lot of individuals have a question about is what if there is a case of COVID-19 in a classroom? Contact investigation has many legs. It goes in many different directions. A close contact is defined as someone who is within 6 feet and for 10 minutes or more of that confirmed case. So if you have a classroom full of children and you have someone who is seated in one particular area, but you have other students who may be more than 6 feet away and have not spent 10 minutes in direct contact of that individual, those individuals may not be required to quarantine. But it will be assessed as part of the plan. So there is a possibility that even though we have a classroom full of children, that the contact case, because of the way they were spaced, does not meet that close contact definition, so all children may not be required to quarantine. Please keep in mind that there is a really good partnership between the schools and Lincoln Trail District Health Department, and there are plans in place that the school has that outlines the steps that need to be taken in the event of a COVID positive case within a classroom. One of the questions that we received often is when someone comes in close contact with a confirmed case, or if they know of a close contact of a confirmed case, should they go get tested? What we want individuals to keep in mind, what we like for the general public to keep in mind, is that it can take anywhere from 1 to 14 days for COVID-19 the symptoms to develop. That's pretty much like the incubation period before you could potentially show symptoms. So we have individuals that have asked us, we know of people who have tested negative, but they go back and test positive in say 5 or 6 days. Is that a possibility? Is that really happen? Yes, it can really happen. I want you to think about the 1 to 14 day incubation period that it could take for COVID-19 symptoms to appear. So that is a possibility. Now, having said that, if you test too early, there is a possibility that that test will return negative, just like in the example that I just gave, so that your viral load is too low at that point in time. But over the course of the 14 days, the viral load gets higher, you go back, and you could potentially test positive. It is not something that we recommend right away. But again, this should be driven by a conversation with your healthcare provider as far as what they consider when you should be tested. But just keep in mind that if you test too soon, your viral load may be too low and it may not be detected. That test, the COVID-19 test, is simply a test of a point in time. At that particular time that you had the test, you were negative. And then if you go 5 days later, then of course, if it turns positive because the viral load, as I mentioned, increases, you could be positive because of the incubation period. So I think it's important for me to describe the difference, or explain, the difference between what is quarantine and what is isolation. Quarantine applies to close contacts. So these individuals have been exposed to a COVID-19 case, someone who has the virus, but they don't have the virus themselves. So they are quarantined for the 14 days. 1 to 14 days, those symptoms can develop. And so because of that, and because of the fact that they may be asymptomatic, we ask them to quarantine at home so that if they do become infected, or if they are asymptomatic, they lessen the chance of exposing other individuals. Isolation applies to those individuals who have COVID-19, so they actually have a case of the virus. They are required to quarantine for 10 days. Now, I've explained the difference between isolation and quarantine, but I do want to stress that those are minimum days. What drives this is symptoms. So if you have a person who is tested positive or someone who is a close contact that develops symptoms, that may extend the isolation or the quarantine period. So for example, you have a close contact who is in quarantine for 14 days, but on, let's say, the 12th day, they develop a cough, they have a fever, and they have some difficulty breathing. That will automatically extend, and if that continues to day 13, 14, we will extend at that point the quarantine period beyond the 14 days until those symptoms resolve or they improve. So when I say 10 to 14 days, I want you to keep in mind that that could be extended dependent on symptom resolution. Now, one of the things that we have has come up quite a bit lately is that there's one person who has come in a family who has come in contact with a COVID-19 case. And the question that we receive is, does that mean that the whole family has to quarantine? I think it's very important for people to know that individuals who are not a direct contact of or close contact of a confirmed case are considered contacts of contacts. They are lower risk. So they would not have to quarantine unless there is something in their situation that says otherwise. But typically, what would happen is the person who was in close contact with the confirmed case, if that was the only person in the family that came in contact with the confirmed case, they will be required to quarantine. The other family members would not. Now, if the family member is a confirmed case, that changes everything. So they're no longer a close contact, but they are a confirmed case of COVID. That whole family has to go into quarantine because we know a household spends more than 10 minutes with each other and they're probably less than 6 feet apart. So at that point, when someone in the family tests positive, then that positive case would have to isolate for the 10 days until symptom resolution if there are symptoms or improvement in those symptoms, and the family would have to quarantine for the 14 days with the same criteria. Now, I mentioned earlier that we have over 1,300 cases of COVID-19, and so we have seen some commonalities in the symptoms. And some of the symptoms that we have noticed more often or more prevalent in our area, the Lincoln Trail District Health Department service area, include headache, sore throat, cough. People have a fever or they feel feverish, runny nose, loss of taste, loss of smell. Sometimes there's gastrointestinal issues where they have stomach pain or abdominal cramping and diarrhea. Those are what we're seeing in Lincoln Trail District Health Department service area. But let me say that it is very important that you understand that you may have none of those symptoms. You could have one of them, or you can have like some or mild case or all of them. It varies from individual to individual and from person to person. So please keep in mind that we are in this together. And I know that we've heard that, but it's really true. COVID-19 is an illness that requires us to care about our neighbor and about our community. It requires us to do our part. It requires us to put on our masks because we may be the one that's asymptomatic and out in the community. If we don't have our mask on and we're the one that's asymptomatic, we could potentially spread it to other people. So it's important that you wear your mask. It's important that we continue to wash our hands as frequently, and physically distancing, keeping that 6 feet or more apart. One of the last things I also want to stress is that flu season is coming. And in a normal flu season, hospitals are strained to capacity. When you throw COVID-19 into the mix, it is just a recipe for disaster. One of the things that we could do to kind of make sure, to kind of help our healthcare workers keep that hospital capacity low is to go ahead and get your flu shot this year, if at all possible. In addition, one of the other things I want to say is that when you have flu on board, so if you have flu, if you catch the flu, and for whatever reason you also end up with COVID, it is not a good situation. So do preventive care, get that flu shot to better prepare going into the fall. As things continue to unfold, you can go to our website at ltdhd.org. So Lincoln Trail District Health Department.org is the initials, ltdhd.org. On the web page, we have a dashboard. That dashboard provides the number of new cases, common symptoms, how people are being exposed. It's just different, a lot of good information, gender, age. It's broken down on there. You can go on there on the dashboard, look at the updated information. We update that information Monday through Friday. And of course, you can also go to kycovid19.ky.gov, which is the state website, and Centers for Disease Control is always a good source of information. Thank you.